Good afternoon and welcome to the seventh of our weekly COVID panel discussions with key community leaders. This is an event organized by Tallahassee Memorial Healthcare, but it reflects amazing cooperation and collaboration across the entire Leon County healthcare community. We've got a couple of important partners I want to recognize. The first one is the Village Square. That's Liz Joyner's operation, which continues to promote civil discourse and discussion in our community. And we need all of that we can get, don't we? Also, thanks to Partners in Communications, which has a sign language interpreter trying to translate my fast talking, and we'll continue to do that on future webinars. And finally, a special welcome to our radio audience on WFSU, which is broadcasting this Monday at 7 o'clock, new time. So if you hop on here late or want to let a friend know, they can listen there on WFSU. My name is Skip Foster, and I will be your moderator today with this esteemed panel. Before we start, if you've missed any of the first 6 webinars, there's so much still relevant information on those. You can find recordings of them as well as an FAQ document that goes is completely comprehensive. All of that is housed at tmh.org /coronavirus. So let's get started, and I would like to welcome in particular the mayor and the chair of the Leon County Commission for being here today. As both of y'all know, Texas was in the news this week for at a statewide level ending its mask mandate. So a lot of folks are kind of wondering, you know, what that means for us. So I wanted to ask both of you, are we changing anything locally in that regard? And if the answer to that is no, what criteria are we going to use to make those decisions? And roughly what kind of timeline do you anticipate when it comes to either the decision making or an actual adjustment? And I see Chairman Minor is off mute, so I will start with him.
Great, thank you, Skip. And first of all, let me say it's good to have you back and on the road to good health. Very good to hear that.
Thank you.
Well, as far as I'm concerned, as chairman of the county commission, I think I can speak for my colleagues on this because we've been consistent for about a year. You know, what we do on the county commission is follow the advice of medical experts and epidemiologists. I'm not a healthcare expert, neither is anyone on the county commission, but for the past year, we've been following the advice of the CDC and the Florida Department of Health in Leon County, and we'll continue to do so. You know, every day in our society, we place faith in the expertise of others. When we hop on a plane, we implicitly place our trust in people, the pilots, the plane mechanics. I'm not a pilot, but and the people that are the pilots, I probably don't know them, but I'm literally putting my life in their hands. And so I'm not a healthcare expert, but I'm choosing to rely on the expertise of those folks when it comes to making a very important decision, such as maintaining the mask mandate. We set our first mask mandate March 16th last year, so it's almost been a full year. And I believe we need to continue to do that based on the advice of the CDC and the Florida Department of Health. A couple of days ago, the new CDC director said, Rochelle Walensky said, now is not the time to stop wearing a mask. And just at the latest COVID briefing about an hour ago, she said that prevention remains essential to ending the pandemic. And to answer your question about the timeline, Skip, again, I go back to the CDC and the Florida Department of Health. The CDC says roughly maybe 2 or 3 months. We have to make a decision on how we adhere to safety protocols. If we continue to wear a mask, if we continue to wash our hands frequently for 20 seconds, if we continue to stay that 6-foot distance from people, we may over the next 2 or 3 months get to a point where we can start to relax those over the summer. What I hope the county commission will do, and I'll certainly be vocal about this, is following the advice of the CDC on that timeline. If things go well, if we continue to maintain those precautions, we mitigate the spread of these variants, which are very concerning. I think we've got a good shot at being able to relax those mask mandates come summer, but it really will depend on what the CDC and the Florida Department of Health are saying.
Well, Mr. Mayor, he kind of picked that bird pretty clean. What else would you like to add to that?
Hey, Skip, by the way, it is good to see you, man. I'm glad to have you back.
Thank you.
And as always, want to thank all the community partners and TMH for hosting us. We've gotten so much positive feedback on these weekly Zoom calls for information, and I think it's great. So hats off to everybody. And, we got a lot of, I'm getting to the question, and I'll answer in a second. But once again, I also want to state all the healthcare professionals that are on this Zoom, that are on the front lines out there, making sure that the vaccination process is going smooth in our community. Can't thank you all enough. Y'all are doing a great job. Keep up the good work. And as I always say, the city of Tallahassee is here to support you in any way that y'all see fit. And we're proud to be part of the team. Look, I think the chairman said it right. Rick and I are really good friends. We work extremely well together, which not all communities can say that the city and the county work so strongly together. It is a county mandate. It's not a city mandate, but of course we support the county in this decision. And to answer your question, look, every decision that has been made, whether it's a county decision or a city decision, we rely upon our local health experts to guide the way. Rick is right. We're elected lay people. We do not have the medical background. So we work together with our community partners to make the decisions that are appropriate for our community. Look, there's been some great news coming from the federal level about vaccinations and accessibility and partnerships that have been created. We all follow our numbers here locally. We're working really hard together. We're heading in the right direction. But yeah, we depend on the medical community to guide us in making those decisions. So, Rick is absolutely correct. Now is not the time to take the foot off the gas. We got to stay vigilant. We got to keep on keeping on. And as we move forward, we will make the appropriate decisions. And we will support the county in their decisions, but strongly encourage everybody to continue to wear their mask, follow the CDC guidelines. It's working in our community. Let's keep moving forward.
Great. Well, I appreciate y'all being on. So let's stay on this and turn to the medical folks because we have a question, a follow-up question from a viewer, which is, what are the objective criteria used to end the mask mandate? Is it cases, deaths, vaccine number, some measurement of herd immunity? Dr. Watson, how would you respond to that? And what are the different kind of buttons on the control panel that we'll be looking at?
I'd say the answer is yes to all of those. And Claudia, actually, Claudia has epidemiologists on her team. We all have people that we rely on to come up with the answers to this, but we actually were in a meeting this morning discussing just that. What is it that we're going to rely on? And Claudia, you may be able to speak better to that with regards to epidemiology studies and the resources that are looking at it from the state and county standpoint, but it is everything you just mentioned is being looked at, Skip.
You want to add to that, Claudia?
Good morning,
Claudia
everyone.
being Claudia Blackburn with the Florida Department of Health, Leon County.
Yes, no, I think I don't know that exact criteria have been established yet, the CDC for those, and I'm sure they're evaluating all the things you said. Is our rate staying well below where it should be? And that's beyond just the positivity rate, it's the number of new cases. And are people, are hospitalizations declining, all of those things. And we're hoping that we will certainly see an improvement soon and be able to loosen up a little bit on some of the restrictive behaviors. We're
Well,
not.
let me ask you this, Ms. Blackburn, just kind of at a more of a 30,000-foot view. How do you, you know, there's not going to be any such thing as risk-free, right? Just like there isn't for all sorts of other diseases and behaviors. I mean, every time we get in a car, every time you know, there's a threat for everything. How do we make sure that, I mean, how do you quantify the threat? And I mean, is there we're not talking about getting to zero risk, right?
Right. I think that, and it's to the point where maybe it's like the flu or any other kind of respiratory virus that doesn't cause severe illness and death at such a high rate, then at that point we would be looking at, is this something we can live with without restrictions?
Okay. Well, I know this is, you know, an impossible thing to pin down, but I think people are interested in it. So I want to come back to Drs. Watson and bring in Dr. Blake. Dr. Watson, of course, is the Chief Integration Officer at Tallahassee Memorial Healthcare and Capital Health Plan, and Dr. Trey Blake is the Chief Medical Officer at Capital Regional Medical Center. Last week, y'all both reported a pretty sharp decline in the number of hospitalizations. Wanted to see if that trend is continuing and what other trends are you seeing? And we'll start with Dr. Blake.
Thank you, Skip. We're seeing that trend continue. Numbers at Capital Regional Medical Center remain low. We got as low as only 11 COVID patients in the hospital. We've not seen that since the beginning. We only had one ICU patient, which is wonderful news. We're seeing that dip level off. Numbers are staying in the low teens, but from our standpoint, things are still looking good.
We mirror
Okay,
that.
how about you, Dr. Watson?
We mirror that at TMH. We had 13 recognized patients in the hospital today, 2 of which are actually being moved out to the floor and 2 in the ICU, so we're doing well.
Great. And how about Ms. Freeman and Dr. Robinson? Janae Freeman with Neighborhood Medical Center and Dr. Temple Robinson at Bond. What are you seeing moving through your institutions in terms of numbers? Start with Dr. Robinson.
Good morning, everyone. My staff has not reported any new cases of COVID over the past 2 or 3 weeks.
Wow.
Our efforts are mostly toward trying to get people vaccinated at this point and continued testing.
Okay, Ms. Freeman?
Okay, we're still doing community testing events as well. So we had 7 positive results that we got in last week. So as of this week, nothing, but as of last week, we had 6.
Okay, great, thank you. Back to Drs. Watson and Blake. I wanted to ask, still there's intense interest in this Johnson & Johnson single dose vaccine. And Dr. Blake, I wanted to see if we've, you know, that news was just breaking last week when we first met. So what have you picked up new about this? And is there any sense of a timeline on when those vaccines might be available locally?
Yeah, this news is coming out daily, so I'll ask any panelists if they know more than I do. But right now it was approved. Florida was scheduled to get over 175,000 doses this week. The governor came out and talked about vaccinating law enforcement, firefighters, and teachers over the age of 50. And there was articles out of Tampa on Wednesday that they had received J&J and already distributed it. So from my standpoint, it's coming, and there'll be more guidance from the government as it gets here. But again, if anybody knows anything else, please jump in.
Ms. Blackburn, did we get any of those, any of that 175,000, were any of those local?
Unless it happened in the last hour, we have not been notified that we're receiving any this week.
It's up to the minute information here on the weekly COVID call.
Claudia, correct me if I'm wrong. The first grouping of Johnson & Johnson is assigned to federal pods. And at least that's what we're hearing from the state representatives. So the likelihood of us seeing it, and hopefully that will change, but this week is going to be low, unless you heard something differently, Claudia, because that's what was reported to us yesterday. Second release will be hopefully to others, but they were very focused, to Trey's point, on some federal distributions.
So is it fair to say, I would just say, is this true or false? If I'm in the over 50 law enforcement, emergency workers, I think it was, who else was in that? Teachers. If I'm in that group, I'm more likely to get the Johnson & Johnson vaccine than the Pfizer Moderna. Is that true or false?
In Leon County, you're not going to get the Johnson & Johnson. I mean,
Exactly right.
Leon, beyond Leon, I don't know, but we don't have it here, and we're going to be vaccinating those groups.
Okay, and so let me ask a different question. If I'm in the over 65 group or the significant underlying condition group, it seems unlikely that, and I still haven't been vaccinated, it seems unlikely that I would get the Johnson & Johnson. I'm much more likely to get the Pfizer Moderna 2-dose. Is that fair to say?
This week, that's fair to say.
Okay, okay. Are there, on that, if I'm 65 and older, is there still a working waiting list? And how many are on that list roughly?
So I think there are many lists. There are the lists that the private providers have, and I think that varies. I'll let Dr. Watson talk about that. But for the shared care list, the myvaccine.fl.gov, that list is dwindling rapidly. So there aren't many people 65 and over for Leon on that list at this time.
Not many is like what?
Well, there are probably about 975, but our understanding is only about 25% of those actually become appointments. You know, so a lot of those people are being vaccinated someplace else. So our list that we're working from for 65 plus is very short right now. Of course, people continue to register, but I mean, that's again what I know as of this moment. But that's
okay. Anything to add to that? Anyone else?
Just real quick, Claudia, did you mention the percentage, the success rate for Leon County? Over 75%, 65 and over have been vaccinated, and that's because you look at the whole group on this screen. That's because of everybody on the screen, and great job, Claudia, leading the charge. And the other thing I would say to that is that as we reach out, and let's talk about TMHPP and others that we've partnered with, we have notified via text, via email, every 65 and over on the list. And we're just finding that when you get above that 75, 80%, some of these folks don't want to be vaccinated. And so we have sent out notice to communicate directly with us. And so it has a little bit of a struggle when you get into that 20% of trying to get people to agree. The first 75%, full bore. These last few have been a little bit more difficult finding people interested. And I would just remind everybody, again, I say this every time, vaccines don't work unless you get one. And so it's imperative that we do vaccinate the community. And you're seeing all these improvements based on these vaccinations. There should not be this fear of vaccination in the community.
Okay, let me just call a brief 20-second timeout because Jocelyn, the CEO of Elder Care Services, has sent us a note that organization will begin providing transportation to the FAMU vaccination site starting next week. So anyone needing a ride who is in the groups currently being vaccinated can call this number, 850-921-5554. 850-921-5554, or you can get in touch with Elder Care Services. And I know that's come up on this call, folks, with transportation issues. So that's an important public service announcement. And thank you, Jocelyn, for sharing that with us. So I want to come back. Do we have a way to identify the 20% of 65 and olders? Do we know those people by name to be able to reach out to them? That's question number one. And question number two, since I believe we're still leading the state in that percentage, what happens if we get vaccines and there aren't 65 and can our county unilaterally decide to open up the vaccine to a wider group than is currently being done at the statewide level? Does that question make sense, Ms. Blackburn?
The question makes sense, and the answer is no. We have to abide by the governor's executive orders, and that's what we've been doing. But there are vulnerable people that can be vaccinated, and that would be, a focus if we get saturated at the 65 plus level.
So theoretically, vulnerable is a word with that the 13 of us might all define in a different way. I know there's probably a CDC definition for that, but there's still some gray area. So if we had vaccine and we had pretty much tapped out the over 65, we could expand that definition. I mean, you can't throw vaccine away, right?
Oh, let me jump in on that. I'm
Okay.
sorry, so what has happened? We have already done all that. So when originally the governor's original, or one of the original, there's been a lot of them, emergency order indicated that hospitals had the ability to determine who was vulnerable and then partner with individuals to engage or designate so that we could vaccinate individuals that were considered vulnerable. TMH took the CDC guidelines and created a vulnerable description out of the CDC guidelines. Our community partners, which are on the screen, worked with us to affect or impact these vulnerable populations. So when we started getting up high into the percentage with regards to 65 and over being vaccinated, we recognized that we needed to do more. So what we did was TMH went out and said, we're going to designate you to help us vaccinate vulnerable populations based on this definition. So it's already happening. Now what the governor did is he sent his next executive order, which then expanded the ability to vaccinate quote unquote vulnerable to physician offices or other locations, pharmacies, et cetera. So he's opened the door for more people to identify vulnerable and vaccinate. So everything you're describing, Skip, has been happening for over a month. About, I don't know, Claudia, you guys can remind, 5 weeks, probably 5 weeks now we've been doing this. So that's why you see our numbers the way they are, because of this partnership and everybody coming together to say, I'll give you a prime example, is Temple will reach out to me and she'll say, or she did, and she'll say, you know what? We have a set group of vulnerable. Are we designated? And we said, yes, you are. Rock and roll. And she did. She went in and vaccinated the vulnerable because she had no more 65 and over to vaccinate. So that's that partnership. And that's why it's worked.
Thank you. I appreciate you clarifying that. There's a lot of folks interested in kind of how these new groups will have access to the vaccine. Somebody liked my question, Ms. Blackburn, about can we identify the over 65s by name so that we can make sure to track them down. What's the answer to that?
I don't know that we have that level of knowledge, but we do have, I know there's a Medicaid list of people that haven't been vaccinated, and those people are being contacted. And then the list of homebound that I believe Elder Affairs is addressing. So we don't have a list of every single 65-year-old other than what the physicians have.
There's a question back to the medically vulnerable about the ability for those folks to register on the myvaccine.gov site. And I think the answer to that question is you have to go through a physician to get that referral. Is that correct? I see heads nodding.
That's correct. That is correct.
I've been on enough of these where I actually can answer a question every once in a while now. That should be actually quite frightening to the entire population. So,
And Skip, if I may,
yes, please.
This is really highlighting the importance of people having a medical home. We're in the middle of a pandemic. You know you have health issues, but you can't get the vaccine because you have not established a medical home. We want people to have a primary care physician for preventive health care, someone who knows your situation that could quickly sign off on a form, someone to help with these chronic illnesses that you may be battling. Everyone doesn't have insurance. If you don't have insurance, we have federally qualified health centers, neighborhood, bond, North Florida. Everyone should have a primary care physician. A lot of people don't need to go but once a year, or sometimes every 2 years, depending on your age and your health status. But no one should be without a primary care physician. There are opportunities all over town to get help. Some of the help is free. Some of the help is based on your income, whether you have Medicaid or insurance. The FQHCs take insurance, TMH takes insurance. Uninsured patients get a doctor and keep a doctor. So you're not.
To follow up on that, Dr. Robinson, and I'm so glad you chimed in. I'm a 23-year-old, just got out of college, or maybe even a 20-year-old that graduated from high school. I'm working a trade job. I go to one of these clinics when I get really need some medicine. What are my, and I called a couple places and they aren't accepting new patients. List those options again. If I don't have a primary care physician and maybe I'm intimidated by that and think I can't get one, what are my options?
Well, most women in their 20s have some form of health care. They may not have a primary care physician, and they should. They may be getting women's health services or family planning services from the health department. But if you're uninsured, especially the federally qualified health centers, Neighborhood Medical Center, Bond Community Health Center, North Florida Medical Center, you can come here. We will see you regardless of your ability to pay, not your willingness to pay, but your ability to pay. So some of the services are free. Some of the services are on a sliding scale based on your income. Some of the services are covered by our taxpayer Leon County funding if you're a Leon County resident and you're within a certain income bracket. We take almost every insurance. We take CHP, Blue Cross, Aetna, all of those. So there are opportunities there, and all of us are taking new patients. That's because you have a doctor. That doesn't mean that you're sick. We want you to stay well, to come in, get a preventive checkup. And if you're a 23-year-old healthy man and you've had all your shots and you're in college, I may not see you but every 2 years. I mean, how many times you guys go to the doctor? Probably not that often. But if you need a doctor, there's a name that you can write. So, yep, I have a medical home. This is where I go.
Well, so multiple thank you, Dr. Robinsons, on that. So it's much appreciated that you spoke up. And I know look, navigating the healthcare world is an intimidating thing for people. It's intimidating for professional people, much less folks that are just kind of entering the real world. We're going to take a pause here and thank our audience with WFSU for joining us. We've got lots of more questions flowing in, so we'll continue to take those, and the WFSU audience can catch up on Facebook later, but we appreciate them joining us. Okay, I remembered to take my little pause that time. So I want to come back and bring Kevin Peters, Leon County, into the discussion because Kevin, we have a question from someone saying, how can a vaccinated person volunteer at this point? And they're saying that Volunteer Leon no longer has jobs for us, so I can't attest to that, but what are the volunteer opportunities for folks now? And what else do you have for us from Leon County?
Well, you know, always I would promote Volunteer Leon as our point for coordination of volunteer opportunities. I'm not real sure about where that comes from, that there's no opportunities. There's always opportunities to give that back in our community. So I would encourage anybody interested in helping, whether it's directly with this effort or some of our other human services agencies that help every day with everyday problems, to call Volunteer Leon, 606-1970. 606-1970. Volunteer Leon, always there to help make volunteer placements. With that, from the county, again, that was great news to hear about Elder Care Services and their opportunity to assist with some rides. That was great new news that I had. As I mentioned last week, a partnership with 211 Big Bend, the United Way, and Lyft is ongoing. They can provide scheduled transportation for individuals that have COVID-19 vaccine appointments at walk-up sites, like the site at Bragg. They can call the number 850-617-6325. Again, 617-6325 to coordinate with 211 Big Bend to get a ride to a vaccine appointment through the Lyft rideshare service. Again, the county would continue to partner with our community health care centers for pop-up testing sites at some of our county libraries. The next opportunity is going to be March 7th at the Northeast Branch Library on Thomasville Road. That's a partnership with Neighborhood Medical Center. It's going to be a drive-through testing site that runs from 2 p.m. to 5 p.m. on March 7th. And then we have another opportunity where we'll partner with Bond Community Health Center to do a pop-up test site at the East Side Branch Library on Pedrick Road. That event will be March 8th, 9 a.m. to 1 p.m. So those are the big goings-on from the county.
Thank you, Kevin. Dr. Robinson, you've been very vocal about this question of how folks can volunteer to help through blood donations and research. Can you just give that pitch again to folks so they know every opportunity that they have to help?
Well, we always are asking people to donate blood regardless of the season, but people who have been infected with COVID, we are very interested in your donating blood or your donating plasma. One of the outpatient treatments that we use for COVID is something called monoclonal antibodies. And those antibodies are gleaned from the plasma of people who have mounted natural antibodies when they've been infected with COVID. So we're asking if you had COVID to please donate blood. Don't try to figure out whether you have the antibodies or not. The people at the blood bank, they know how to do this, and you'll help someone else. So that is very important. And some of the other treatments we talk about as an outpatient, we're actually now doing studies. One of them is called Active 6, and we may be joining that study very soon. That is an outpatient study looking at some common medications that have been on the market for hundreds of years to see if that will help people in an outpatient. Things such as colchicine that we use for gout, blood thinners, heparin, and so forth. The other study that Bond and TMH are involved in right now is the Active 4 study, which is looking at preventing blood clotting and deep vein thrombosis and blood clots to the lung. We're looking to see if giving people an aspirin or a blood thinner as an outpatient when they're diagnosed with COVID can prevent some of these tragic outcomes that we're seeing. So it's no experimental medication, just randomization of patients between placebo and an over-the-counter, and a prescription blood thinner.
Great, thank you for that. Ms. Blackburn, let's talk about these variants. We've had a few questions about that. How are we testing for those locally, and how many cases have been identified locally?
Sure. So since the beginning of the pandemic, the Bureau of Public Health Lab in Jacksonville has been sequencing a random sampling of positive tests for COVID and in search of variants. And there are multiple commercial labs that are also collaborating with the CDC to sequence samples of positive tests. So far, Leon County has had 4 of the UK B117 variants identified since the beginning of the year. So that's where we are right now.
So Doctors Blake and Watson, what does that mean? Why do I care about a variant? Is it, what does it mean?
Well, I'll take that one. A lot of people are greatly concerned that there's some degree of different effectiveness of the vaccines towards the variants. The medical community is hyper vigilant about this, but as of today, we've not seen any variant where the effectiveness warrants not getting a vaccine. So we're going to continue to track the variants, make sure the vaccines are working. The other problem is some of the variants have what we call different penetrance models. So one variant may be more contagious, but may lead to less morbidity or mortality. So as physicians, it's important for us to know what's going on with those variants, know what's in our community and how they act different, but there is no evidence today that should affect our dedication to getting everyone vaccinated with the vaccines we currently have.
Okay, want to add anything to that, Dr. Watson, or did that cover it? A viewer asks heard Dr. Watson state that the vaccination rate for 65 and older is over 70, at or a little over 75%. So they want to make sure they heard that right, and then wanted to know what the vaccination rate for African Americans are in that same group in Leon County. Is that something you have, Ms. Blackburn or Dr. Watson? Ms. Blackburn?
Yeah, I can confirm that we're at 75% of 65 plus that are vaccinated as of today, but 36.8% of African Americans 65 and over in Leon County are vaccinated. So there's quite a disparity.
I didn't hear did you say 38%?
36.8%. It's about
36.8%.
Yeah. Mm-hmm.
Okay. So that would, I mean, trying to do the math loosely in my head, that would say basically every white person, almost every, I mean, a super high percentage of whites to get to 75 from 38 of a third of the population, the white percentage must be really, really high.
We have not calculated that, but yes, I would
Okay.
assume so.
So Ms. Freeman, I want to come to you then. While with this, we've talked about this a lot and the cultural issues, and there's certainly a lot of statewide political stuff that we will let others get into. I wanted to see if you have any new perspective on this since the 2 or 3 weeks that we've talked about it, and also wanted to get you to talk about the importance of continued testing. I know we've got this real vaccine focus, but how does testing kind of fit into this now?
Testing should not be something that stops in our community. The only way that we can continue to fight this pandemic is being aware of what we're facing. So testing is very important. We continue to test at our health center on a daily basis. We test every other weekend at the library locations in partnership with the county, and also just educating the community about that. I think that the PSA that will shortly air that we just completed will definitely put major emphasis on educating our community about the vaccine, educating the African American community about the benefits of the vaccine and their overall health outcomes. That's what this is all about. It's not just COVID. These are overall health outcomes that are having some effects from COVID that we need to deal with. You know, with COVID, you're still hypertensive, you're still diabetic. There are other things that you still need to make sure that you have a healthcare provider for. So this has really opened the doors for federally qualified health centers, as Dr. Robinson stated. A lot of people, well, I didn't know you were here. What do you do? What is an FQHC? We're here for you. We're in your community. We're in your neighborhoods, and it's throughout our country. We're here to take care of the people in our community where they live. So continued education is definitely the key.
That's really helpful. Thank you very much for that. There's a question about international travel requires a PCR test within a short time frame, no more than 48 hours before arrival. Do we offer locally PCR tests that meet that timeline? A friend had to go to Atlanta to meet that because there's no local test with a 48-hour turnaround. And I mean, it's easy to say, yeah, well, we'll worry about something other than your vacation, but this could be business travel or visiting family. Does anybody know, have an answer to that? We don't offer a 48-hour under 48 hours.
I would just caution everybody on this question. We do offer rapid turnaround for PCR. Our main focus is on those that are symptomatic or that we are screening for disease. I think that those individuals that are traveling, I appreciate travel. I haven't traveled in a year, but that really is kind of a second stage, if you're second tier for us. And we have the ability to turn around PCR rapidly. Hospitals can turn it around in 4 hours. Our TMH FSU lab can turn it around in less than 24 hours. There are clinics in town that can turn it around in less than a day. And so my suggestion for these individuals are to communicate with your provider. And I'll just remind you that these may not be paid for. So if you're not symptomatic and you're going to a provider just because you want to travel to Sweden or Switzerland or wherever you want to go, does not mean that that's the responsibility of your insurer to pay for that. Although you read the mandates come across this country, that one's going to get into the gray zone. If it's for some personal travel or personal use, that is going to be questioned. So just be mindful of that. But please go through your provider because they all have the resources to get it back in a short period of time.
Okay, that is about 45 minutes worth, which is where we've been having these, and our questions have slowed a little, so we're going to wrap it up right here. Another just great session. Thank you, Commissioner Minor and Mayor Daley, for being here to get us off to a good start with clarifying our what's next on our mask policy, and then of course to our medical experts. Representative Ausley, I see your face down there. Is there anything you would like to add to this group before, there you are, before we sign off? And you're on mute, so.
Just thanks to everyone. I really appreciate all of the healthcare providers.
Senator Ausley,
That's all right.
I'm sorry about that.
It's okay.
Your reputation precedes you.
But everyone on the call also has to take care of patients. So thank you for taking time out of your days to taking care of patients to keep us informed. It's really helpful. So thank you.
Thank you for being on the call and lending your support to this effort, Senator. It's means a lot, and I think really signals to this group how much you value their contribution. So thank you very much. Commissioner Minor's hands up.
Thank you, Skip. Just one thing I wanted to touch on that was brought up a few minutes ago about the vaccination equity in this community and the wide disparity between African Americans and the general population. On March 10th, we're launching a public awareness campaign with Ron Sachs, City of Tallahassee, and then many other partners to try to get the word out, increase the word going around town about the value of vaccination. So we hope that will start to turn the tide on that very wide and concerning discrepancy on equity for vaccinations. Thanks, Skip.
That's an important point, and I appreciate you making that. Anybody else have anything to add? Anything we didn't cover here that you wanted to get to? Okay, well, thanks everyone for joining us. We will see you next week, and then the following week, we will probably be taken off for spring break, but everybody continue to be safe out there. And again, thank you to all of these community leaders for taking the time to keep you informed. So have a great weekend, and we will see you next week.